The webinar is now beginning. Ladies and gentlemen, I now turn your attention to the founder and CEO of the GoodLooking company, healthcare attorney Jonathan Kovar.
If you could go back in time 16 years to a small town in Nacogdoches, Texas, and visit a small home care consulting company, you could possibly see me as a 21-year-old kid struggling to learn the healthcare industry, computer programming, and life in general. I was precocious enough to question anything and young enough to still think I knew everything. And that's when we first started building software for home care providers. Now that I'm old enough to have a daughter in college, I laugh at how little I really understood back then. But it was the beginning. It was the start of an adventure that's been with me for nearly 2 decades now. I won't bore you with all of the details of our journey since that time, except I want to quickly bring you up to speed on where we are now. Several years ago, I realized that software, regardless of my best intentions, was never going to be the answer to the problems facing our healthcare system. I've seen too many instances of a software solution that ended up being a people nightmare. And yet it's people who are the real answer, smart, innovative, enthusiastic people. And we were all doing a pretty sorry job of helping people. Software developers were either trying to replace people or overburden people. And I wanted to empower people. And I finally realized something I didn't know. I didn't really know how to help people. So for the past 10 years, I've been traveling the world on a mission to really learn and to understand. I wanted to see how the best thinkers, the most prolific doctors, the most compassionate nurses, and the most involved patients really work. To see beyond the nonsense that people were selling and instead try to capture the real soul of healthcare. And I think that's what we did. We watched and we looked for opportunities to empower people. For the past 3 years, we've been building a new platform to empower healthcare workers, doctors, nurses, caregivers, patients, billers, collectors, marketers, recruiters. If your life's work is to heal the world, then we wanted to empower you. We now call that augmented intelligence. We will never replace you, and we don't want to, but we do want to give you the information you need, the tools you need to work faster and smarter. We want to be your partner and your helper. We want to empower you to heal the world. And that's why we've created the new GoodLooking app with augmented intelligence for healthcare. We're going to spend the next few moments digging in depth to seeing what augmented intelligence really looks like. So let's start with augmented intelligence for clinicians. What if you had a software platform that could automatically track more than 1,200 data points for 38 key medical necessity indicators? What if you had a platform that would automatically build a care path based upon medical necessity, homebound status, payer requirements, authorization requirements, to give you the absolute best chance at getting paid the most amount of money, being the most compliant and the most efficient healthcare provider that you could be? What if the system alerted you to problems about your the current schedule that you're trying to complete, alerted you to new conditions with your patients, helped you to reduce calls, mileage, and missed documentation? That's what we consider augmented intelligence. This new platform is designed to immediately show you everything at a glance right here from your right here on your dashboard. As soon as you log into the system, the software is going to give you an updated list of everything you're supposed to do that day, whether it's visits, interviews, supervisions, you name it, right here from your dashboard. You can move visits around for that day just simply by dragging and dropping those visits. The system's automatically going to alert you to missed documentation, allowing you to instantaneously complete past due documentation and keep track of all of your to-dos and reminders for the day. As a clinician, after you've logged into the system, it becomes very easy for you to go offline. All you have to do is, once you've seen your visits for the day, click on travel mode. The system's automatically going to allow you to travel in and out of the office with or without an internet connection to complete your documentation for that day. You don't have to download any software. You can use the software on a tablet or a laptop or even a mobile phone. And you'll have everything you need right at your fingertips, including the ability to route your day, where we'll give you the directions to your visits. We'll also help you plan out the most efficient trip in order to make the round trip for your daily schedule. You have all of your messages and alerts and communications from the office right here at your fingertips, including the ability to conduct marketing visits, interviews, visits, and tasks are all right available from your dashboard. If you were going to conduct an interview that day, the system automatically gives you the forms that you need to complete that automatically track back to your employee file, to your applicant dashboard, as well as the visits that need to be completed that day, along with the information that you would need to start your visit. Augmented intelligence for us means the ability to eliminate the headaches that are in healthcare. So for instance, if you're driving and you need to contact your patient, you no longer have to look up addresses and phone numbers. You can simply click on the call button, and with our integrated phone system, simply click on the patient's phone number and immediately dial and start talking to your patient. Or if you're running late or need to reschedule your visit, all you have to do is click a button and say, I'm running late, and say you want to send that to your patient and your case manager, and a text message is immediately sent to all the people involved in that in the care for your patient that need to be notified. And finally, we make it very easy for you to actually complete your documentation. So whether you're a nurse, a therapist, a physician, a home health aide, you get the same type of dashboard where you just simply click begin. And we've tried to make the system as intuitive and easy to use as possible. So from one simple dashboard, you have everything you need to complete your documentation: patient name and contact information, the ability to reschedule your visit, map your visit, supervision forms, authorization reports, lab tests. When you're ready to start your visit, just click on the start button. The system is smart enough to know that if you're completing an assessment for a Medicare patient, you automatically have to complete your Start a Care Oasis. Or if you're completing a nursing visit assessment for a hospice patient, that you need to complete the hospice information set or an bereavement assessment. The system tracks your mileage and your travel time. It also automatically alerts you to new conditions that may be causing concern for your patient, new additions to the patient's medical record, and any type of risk indicators associated with that patient before you get started. We've attempted to make your assessment as simple as possible. Instead of interfering with the way you conduct your evaluations with your patient, we've made the system incredibly easy to use and completely paperless. You now have the ability to go through your admission documentation right here on the screen and have your patient sign off on consents to photography and video and all of your admission documents that are automatically allocated into the patient's portal so that they have access to that information at any time. We've also rearranged the flow of information so that the system gets out of your way and follows along with the flow of the visit. So instead of having cumbersome labels and text to read through, you have a lot of sliders that just by color coding immediately alert you to problems with the patient's condition. And instead of giving you 1,000 different prompts that you always have to look at and always have to follow along with, the system's smart enough to only give you prompts that are necessary based upon your assessment. So you never have to do extra work, but you always capture the information that's necessary. So based upon the information that you put in, the system will give you additional prompts. Let's look at mobility for an example. As you go through your mobility assessment, we automatically, by color coding, let you know where the problems are with your patient's condition. You have the ability to conduct several different fall risk assessment types. So if you did a timed up and go assessment, for instance, the system's automatically going to let you know if the patient has a high risk for falls. Your integumentary section automatically gives you a body system assessment and flags for wound care information. And based upon the assessment information that you're completing, your OASIS documentation is automatically verified and calculated with you, and is integrated directly into your assessment. Remember that fall risk assessment that we just did, because that plays a small role in how we calculate and help you automate the creation of your care plans. The system automatically is tracking more than 1,200 data points to help you immediately build a care path that justifies and supports medical necessity for the services that you're doing. We have 38 different medical necessity indicators within the software for a skilled nursing document. These are different for therapy versus physicians versus hospitals, but I think the nursing care plan gives you a very good indication of how these data points work and how augmented intelligence is designed to really speed up speed up the creation of your care plan while also protecting you from legal audits or regulatory audits. So for instance, by filling out that fall risk assessment and filling out an assessment based upon your patient's mobility, the system automatically knows that your patient has a fall risk concern and adds that onto your care plan. So when you go to create the care plan, the system also builds the story for you. So instead of an auditor or a surveyor needing to go through all of your documentation and figuring out the data points themselves, we actually convert your assessment into a story for the surveyor automatically. So in this case, in this situation, we're automatically telling the surveyor, putting this on your plan of care and in your documentation, that your patient is at risk for hospitalization due to a fall risk. We automatically put in medical necessity scoring and support. So in this case, it's letting us know that the patient scored an 18, which is a high fall risk on the timed up and go test, and the patient's also taking 2 high-risk medications. It becomes very easy to customize your plan of care based upon the patient's true medical condition. Assessments, instructions, procedures, communications, and goals are all right there at your fingertips. Now, if you were to carry this forward onto an actual plan of care, this is an example of a custom plan of care built out of the software. And you can see that at your fingertips, you immediately have the health history and patient summary that supports all of the interventions that you will be doing during that certification period for that patient. The system automatically creates this narrative for you based upon inpatient history, fall risk assessments, mobility assessments, tracking all of the medical indications and risk factors associated with that assessment and with the interventions that you're going to perform. It automatically gives you vital signs or medical conditions that signify a problem with that patient's condition, new or changed medication that would support medical necessity, new or changed medical conditions that would require teaching or procedures to be performed, as well as complicating factors that give you extra medical justification and pertinent health history facts for that patient. The new plan of care was designed in a way that an auditor or a payer who's trying to approve authorization immediately has at their fingertips the problems that your treatment plan are solving for that patient, showcasing what would happen if your medical interventions were not introduced into that patient's medical care. And that happens, like I said, for more than 1,200 indicators for 38 medical interventions just for skilled nursing alone. Now, after that care path has been created, augmented intelligence effectively keeps all of your nursing staff in compliance from that point on, because when they go to complete their visits, the system automatically tracks the frequency and procedures that need to be performed for that patient on every visit, alerting them based upon priority, previous interventions that have been performed, and upcoming or new conditions with that patient. So for instance, based upon the assessment we just performed, when I go to complete a skilled observation and assessment for the cardiac system, I immediately know what the protocol is that's on the plan of care, which was generated based upon my evaluation. But now all my medical necessity information is also automatically built into the software. So whenever I conduct a skilled observation and assessment, according to most payer guidelines, including Medicare, we have to justify why that skill was necessary in the first place, which is going to be based upon the patient's condition either being currently unstable or that it's stabilizing, but we've had some issues within the past 3 weeks, or that the patient's condition has stabilized, but there still exists some type of complication that requires further observation and assessment. In this case, the system is smart enough to know that the patient still has a currently unstable condition due to edema and peripheral pulses and other cardiac symptoms that were highlighted previously on the assessment within the past 7 days. It automatically tracks complexity of skill, the outcome of the skill, patient's response to your skill, any problems that were noted, and any updates that need to be made based upon that skilled observation and assessment. Similarly, if you were going to teach, or if you were a therapist who was performing a lot of interventions based upon short-term or long-term goals, the system automatically tracks whether your patient is progressing toward your goals, not progressing, or if they've met that goal, and tracks information related to how the patient is progressing or not progressing automatically, again, using those key performance indicators from the assessment. Once you've completed one of those tasks, the system automatically moves it down into the completed section so that you no longer have to complete that. So at the end of the visit, all of your assessments will have been performed so that you know you've maintained compliance each and every visit. The system automatically tracks your medication list as you enter it, giving you alerts for high-risk medications, also automatically tracking drug interactions and contraindications. The system automatically allows you to track communication activity. So if a shift is ending and a patient is complaining of nausea, it becomes very easy to document that so that the next nurse who comes on board immediately sees a condition that needs to be monitored and evaluated for that patient. You can create communication notes, physician orders, incident reports, and other documentation directly from the screen. If anyone else on your care team needs to have a report sent to them, you can immediately do that as well. When you end your visit, you have the ability to capture patient signatures, agent signatures, and have a lot of validation performed. Validation that can be scheduled based upon the tenure of the nurse at your agency. So if you wanted to automatically audit every nurse who has been employed with you for less than 30 days, the system can immediately send that visit note to your auditing team to review. And whereas if you've had a nurse on service with you for years, you can set the system to automatically just spot check some of those assessments. And again, you have all the documentation that you need right here at your fingertips for extra documentation purposes. Let's look at augmented intelligence for human resources. Imagine that you're an HR employee and you were able to use a system that automatically reduced or virtually eliminated your employees' non-compliance. Check their licensure, their trainings, their documents that need to be turned in for HR. What if you had a system that automatically kept your employee files up to date, automatically trained your staff, automatically ensured that your staff saw and approved all of your new policies and procedures? What if it automatically tracked and reduced your payroll expenses, calculated and reduced your overtime? That's what we think of when we mention augmented intelligence for human resource workers in the GoodLooking app platform. For an HR employee, you automatically get a listing of all of your employees' missing or expired credentials right at your fingertips. This would include I-9 documentation, training material that they're supposed to complete, nurse licensure, OIG checks, background checks. Anything that's missing or that is expiring or coming due is available to you from one screen, where you have the ability to update that very, very quickly. The system also has the ability to create and conduct training courses online. So for instance, if you wanted to create an orientation for your wound care nurses, you can actually have that set up directly within the software. More importantly, not just having that training available in the software, but if you hire a wound care nurse and you require this training course to be performed, the system can automatically assign that training course to the nurse so that they complete that training before they ever come on board to work for your agency. The system also has a full policy and procedure manual built directly into the software, which allows you to create and complete and keep updated your entire policy and procedure manual. And at any time when a policy is updated, the system will alert your entire staff that's appropriate for that policy by letting them know that they have a policy to review and sign off on. So you immediately have an audit log of every employee to ensure that they've signed off on all of your policy and procedures. The system also has a really in-depth payroll system that allows you to track and assign pay rates based upon a number of different indicators. Service codes, patient accounts, payer accounts. You can set up individual pay rates for your employees with first shift, second shift, third shift bonuses, holiday bonuses, multiple calculations that the system will do for you automatically to give you really in-depth payroll reporting and payroll expense calculations. On a similar note, let's back up just a little bit and talk about augmented intelligence for recruiters. If you're an agency that lives or dies based upon the quality of employees that you're able to attract, you absolutely have to have a solid recruiting program. So for us, augmented intelligence for recruiters means that we've created a system that automatically helps you get new recruits, automatically assist your recruiters in prioritizing new leads based upon their skill level, their distance to the job, their job experience, their salary, their case level, their interview skills, and more. The system also automatically helps your recruiters make more calls and get better results, and it also automatically ensures that your new hire paperwork is completed without your recruiters having to do that work manually. To that end, we created our recruiting platform. A recruiting platform gives you the capability of creating online campaigns that you can link to from Indeed.com, Monster.com, or from Google AdWords or Facebook accounts that allow your applicants to immediately sign up for a new job. So if you were searching for a wound care nurse, you can capture their name, email address, resume information directly from your online campaign. You also have the capability of importing or uploading a resume to automatically generate a new lead. When someone fills out that campaign or you upload a resume, the system automatically tracks your leads, automatically ranks and prioritizes them based upon the job that you're recruiting for and based upon their distance to the job, their skill level, their case level, and their salary range. As you can see, your list of leads is automatically prioritized, and it's even color-coded so that as you're doing recruiting, it becomes very easy for you to identify people you're not supposed to call anymore, to highlight their licensure and case level, attributes that help you schedule that employee or match them up with other patients. You can schedule interviews or other events, track notes, track your interest and their interest in the job, likes and dislikes, and you also have the ability to immediately convert them to an applicant. Whenever you convert a lead to an applicant, the system will send them an email allowing them to log into your applicant portal. It also allows your recruiters to immediately begin tracking all of the new hire paperwork, trainings, and policies that that employee or that applicant should be looking at and completing. So if you're an applicant, this is what your applicant portal looks like. You immediately have your messages and calendars. You have all of the forms that you're supposed to complete before you're hired. So as an applicant, I can go ahead and complete my I-9 form or my W-4 form, as well as several other types of documentation that would be needed. I can go ahead and review policies and procedures required for my job. I can also go ahead and complete training courses for my orientation, and I can even take tests and skills competency checks before I'm ever hired. These documents automatically are tracked back to your applicant tracking system, so you know as soon as any of those credentials have been met. And you're also able to very quickly pull up a map of the patient or of the applicant, along with all of the patients that are within their geographic area who have open shifts within that time period, making it really easy to know which patients you can match up with certain employees or certain applicants. Let's talk about augmented intelligence for staffing coordinators and schedulers. If you're a scheduler, the system gives you a brand new scheduling interface with drag and drop capabilities, automatic tracking of authorization and order frequencies and limits. It also makes it very easy for you to repeat, copy, or remove visits from a schedule. If you needed to fill a shift, the system makes it very easy for you to get a list of all of the employees who are within that geographic region who meet the patient's qualifications. If they speak Spanish, or you need someone who's certified for trach or vent training, that information is automatically taken into account. For us, augmented intelligence means that this list is automatically sorted based upon the employee's criteria and qualifications, their case level, their distance to your patient, the number of visits that they already have scheduled on that day, and their salary requirements, so that you can choose the lowest cost employee who has the qualifications necessary to perform that visit. In addition, as a recruiter or as a scheduler, a staffing coordinator, I can very easily select all of the employees that I want to alert to this open shift. I can send them a text message or an alert through the software where they can immediately see this information, view extra information about the patient or the shift, and sign up for that particular open shift. So it makes assigning and filling open shifts extremely easy. In addition, you have the capability of doing very advanced billing and collection invoicing activities. So if you have a shift that needs to be billed to Medicaid as well as to a school district, you have that capability without splitting out your visit. You have the capability of selecting whether you've notified the patient whether you've notified the employee. You also have the ability of scheduling and tracking tasks such as interviews, supervisions, or personal activities such as doctor's appointments. And the system keeps those all up to date on your schedule automatically. In addition to that, the system also gives you the ability to upload files or create extra documentation such as PTO requests or payroll adjustments, employee event logs, or missed visit reports that are automatically attached to that particular shift. Let's look at augmented intelligence for marketers. In a similar way to our recruiting platform, we have something similar for your intake staff and your CRM or your marketing staff. You have the ability to create campaigns that allow you to track Google Analytics or Google AdWords activity to automatically capture new patient leads or new contacts within the software, and to immediately track all of your referrals. So if you have a pending referral for skilled nursing, you can track every event that's occurred for that patient. So in this case, we know that the skilled nursing evaluation has been scheduled but not performed, that the patient requires a level 3 employee to perform this visit, who their primary payer is. And for us, augmented intelligence takes it several steps further than that. The system will automatically allow you to receive deposits and payment information for your patient. So as you expand and take on copays, deductibles, not only does the system give you the ability to capture those payments within the system, it also allows you to check eligibility and verification, and more importantly, can instantly give you a profit and loss analysis based upon the patient's eligibility information, their copay and deductible information, how many visits are expected, whether that's visits or hours, and the expected patient responsibility. So before you ever admit a patient, the system can help you plan your care plan, your frequencies, and your profitability for that particular patient, so that the patient gets the very best care in the most efficient manner according to the financial resources that are available at that time. The system obviously has a patient and family portal available for you as well. And in addition, you have the ability to assign out intake coordinators, scheduling coordinators, financial coordinators, QA coordinators, so that the system knows immediately who to alert to any type of problem occurring with that particular patient's account. So if you have a visit that's past due, if you have a new incident report, if you have a bill that needs to be collected, the system automatically knows who to alert to that particular need and to help them complete that task in the most efficient manner possible. Let's talk about augmented intelligence for billing and collection staff. Based upon the financial coordinator for that patient or for a payer, the system is now smart enough to immediately and automatically bill clean claims for you on a nightly basis. The system will automatically check claim status for you, and it can also automatically download and post 835 payment files on your behalf, so that you simply have to review them and approve them, but it's eliminated the vast majority of the work associated with billing and collections. The system has over 100 different settings and data points associated with each payer and each patient that allow us to control and automatically handle most of your collection activities. For instance, the system can immediately download and track all of your payment information per patient, track those back to your bank account and chart of accounts, automatically bill and start collecting on each of your outstanding invoices. For us, augmented intelligence for a collector means that you no longer have to run an AR report. The system will automatically give you a collections dashboard that intelligently prioritizes and sorts your outstanding claims based upon the payer, the dollar amount that's still outstanding, the status of the claim. The system knows when the claim has been rejected by a clearinghouse, when we're waiting on a payer to adjudicate an invoice, when we're waiting for an appeal to be processed, and will automatically sort and prioritize your collections activity based upon that, alerting you, for instance, based upon the very, very fine-grained payer information. The system's smart enough to know that Medicaid pays you on a weekly basis, but Blue Cross won't pay you for 30 days, and automatically setting your alerts based upon that. Your new invoice screen allows you to post adjustments very easily, track collection activity, and also allows you to request actions by your CFO or your billing supervisor. So if you wanted to request that a claim be appealed, or that a refund be generated, or that a contractual write-off or denial be accepted, but it's above the dollar limit that's set for an individual collector, you can immediately assign that out to a higher level employee. When they log into the system, they're immediately notified about all of the actions that are outstanding that need to either be approved or completed, again, right there at their fingertips, along with their alerts and any of the billing and collection activity available to them. Let's switch accounts and look at augmented intelligence for QA staff. If you're a quality and assurance coordinator, the system now is smart enough to immediately give you a list of all of the visits that you need to review based upon the maturity level of the employee, their length of employment with your agency. It's smart enough to route documents to you if they have errors, or if they are of a certain type, like evaluations or visits that create plans of care. You also have the ability to complete QA audits directly within the software. And the system is smart enough. Augmented intelligence for us means that the system will immediately let you know which nurses or employees are causing you more complaints, are creating infection or quality control issues, or creating other types of quality issues for your company, all down to a very granular auditing level. The system's able to track incidents, allowing you to respond to infections or complaints at the employee or the patient level. So all of your quality assurance logs are directly within the software. In addition, the system is also smart enough to help you stay out of surveyor trouble, so that when a surveyor comes on site and requests to review the documents for a particular employee, we have a surveyor portal that they can log into where they only have access to the documents that you've explicitly approved for that surveyor to see. So you can control your quality outcomes or your ability to audit and review those quality outcomes before you send them on to the surveyor or a third-party auditor like a zone program integrity contractor. It gives your QA team the extra layer of protection versus those documents going out automatically. Last but not least, let's talk about augmented intelligence for administrators and CFOs. One of the things we wanted to do with this new software was to help agency administrators, hospital or physician administrators be able to properly track the business level activities within their company. So now the system is smart enough to immediately alert you when you have certification and licensure renewals coming due. when your emergency disaster preparedness testing needs to be performed, when you have a state survey that's coming up and you need to prepare for that, along with a multitude of other additional tracking activities, keeping track of your files, your emergency response credentials. It can also alert you automatically to help you with payer information. So if you have a contract coming up for renewal with a payer, if you need to do marketing outreach on a quarterly basis, or if you wanted to do a reimbursement rate audit, the system can immediately notify you to those and help you complete those, in addition to helping you with quality metrics, reimbursement metrics, and other company-wide data points. And that's in addition to, of course, all of your security roles, being able to run reports and analysis within the software. And of course, even as an administrator, you have access to your dashboard with immediate alerts to quality assurance, billing, collections, marketing, and recruiting activities, all at a glance. Then last, I should mention what we call augmented intelligence for everyone. Imagine this setup. When you hire a new employee, the only thing you have to bring to the table is an internet connection. With a click of a button, we can automatically ship your new employee a tablet computer with mobile device security, cell phone data connectivity, a phone number, email, and texting capability, and a software account that's automatically configured for that nurse, that home health aide, that doctor, or that staffing coordinator. That's what you have within the software. We have now integrated in the ability to have phones, faxes, emails, text messaging, all directly within the software. So you can now assign and track and coordinate communication company-wide. If one of your employees leaves, you no longer have to disconnect their phone number, scrap their email address, try to forward emails from their account to someone else's email. Within the new system, when an employee leaves, the business continues as is, with all of that communication being immediately funneled up to their supervisor or to the next employee on the list. You have immediate granular control over all communications within your agency, regardless of the communication type. Whether that comes in as a fax, an email, a phone call, a voicemail, that information is immediately available to you directly from your communication platform. That's what we call augmented intelligence for healthcare. And that's just the beginning. I obviously don't have time to show everything within the software, but I think that gives you a pretty good indication of where we're moving with the new GoodLooking app platform. If you're interested in more information about the platform, or you're interested in signing up, you can go to www.goodlookingapp.com and click on the sign up button. One of our technology advisors will be more than happy to schedule a training session for you to help you transition into the new platform. Thank you for giving me your time and attention today. I wish you all the best. This webinar will be available for download on our website, www.goodlookingapp.com, by the end of this week if you want to share that with your friends or other employees. I wish you all the best. God bless you and the work that you're doing.